Okay, now I am visible also, and my slide is also visible. And I hope this session will help you to understand the most lucrative arena, which is going to be in the near future. Already it has been started, but unfortunately, we are the doctors, are the professionals, are not gazing it. So I believe that this session of Ayurpreneur Academy will give you an insight, and it will make you to think out of the box what you are already knowing, how it can be branded or packaged in a different way, and how it can be made for the uh, lucrative. Okay, so let me, if my hide my floating this one. So welcome to the Ayurveda universe. So we are at the mission to build our own Ayurveda universe, and a lot of things are there which are in Ayurveda, but unfortunately we are not able to make use of it to help the others to uh, have the quality life, improved life, and especially when it has been in our DNA, when it has been in our soil. But unfortunately, we could not make use of it. So today's session, what I'm dwelling upon is the whatever has been told in Ayurveda, why it has not been branded or packaged in such a way which becomes more attractive for the whole globe. When it comes from the Western world, we accept it as if it is a nectar for us. But when it is already existing in our what you call the uh, science, but we are unfortunately we are not making use of it. So this particular session, I believe that and a thought provoking for people, and you'll enjoy it. And from today onwards, you can think of a lot of different modalities of the Ayurveda, principles of Ayurveda, which can be packaged in the form of an integrative medical practice, and you can make a specific revenue generating model. Okay, so let us go in the session proper, the scope of integrative medical practice for Ayurveda professionals. Now, the question is why Ayurveda professionals should think of an integrative medical practice. Because see, the basic thing is that we are meant for, or we have been trained in our whatever the classical teachings are there, that we are meant to guide our patients to heal from inside. How many of you agree with me? If you agree with me, type yes in the chat box. Because see, we are not the only the people who are dealing with the physical matter. The Ayurveda speaks about the health as an integrated and total summing up of the body, mind, soul, senses, then even the dosha, dhatu, and mala. Samadosha se samagnisha, samadhatu malakriya hai. Prasanna atmendriya mana ityadi ityaswasta vidhiyate. So the total, the very what you call the health for our Ayurveda concept is to see a holistic approach. And that too, we believe that we have got that energy in us which can help us to heal ourselves. So we are meant for that. So when we have got that attitude of guiding our patients to heal themselves from inside out, we are supposed to think about this integrative medical practice, because the whole Western world is now looking for this. The whole Western world is claiming that they are supposed to look towards the other aspect of the healthcare system. Okay, so they are telling that now they are inclining towards the sole concept, our concept of creating a healing system from the inside. Because see, all the lives which are existing on the earth, they have got their own capacity to heal themselves. Animals heal themselves, birds heal themselves. For all the what you call the means majority of the disease, unless it is of course beyond their control, but which are in the physiological limits. Only because of the variation in the physiology, they are able to heal themselves. That same thing holds good for the human race species also. So for that reason, we need to think about an integrated medical practice, because already Ayurveda is speaking about the Trivida Chikitsa. Okay, so whole Ayurvedic principles, they support holistic practice based on incorporating all the organ system and the mind-body connection to achieve natural healing. Isn't it? The medicine for 21st century is going to be foundational integrative medicine. So this, the whole world, the Western world is looking for the medicine as the foundational integrative medicine as the basic medicine, or the most, what you call the first line of medicine for their own society or their public. And there is a growing dissatisfaction with the present medical system in the Western world, because they know what is the, what you call the disadvantages, demerits of the allopathic medicine. And because of that, they are looking for towards an integrative system of medicine, where they want to combine their conventional medicine with the other alternative medicines, as well as the support complementary medicine. So this is time why we should, the Ayurveda people, already we know the lot of things which are already integrated in our science, this holistic one, which is the right time to think about. Look what Mark Starr, the famous author, a physician himself, author of hypothyroidism type 2, the epidemic, and another book he has got in his name, Heart Attacks, Heart Failure, and Diabetes Prevention and Treatment. He says that the truth about the healthcare in the US, okay, or in the Western world, should steer their country into action to change the status quo, which is causing their citizen great distress and suffering. Okay, he says that the truth is that their healthcare system is not the holistic system. It is causing the great distress and suffering for them. So when those people, the learned people of the modern medicine, when they are looking for integrative medicine, we as an being an Ayurveda people who are already have been taught about the holistic medicine, okay, we need to think about it. The second thing why we need to think, the second reason, major reason is, as a part of the what you call the revenue generation, it is to create our own blue ocean to stand out of the competition. So if you start with the integrative medical practice, you'll be able to stand out of the competition. You can create your own blue ocean. You can create the expansion of your business. You can set up a legacy. You'll have financial independence. You'll have time freedom. You'll achieve professional significance. You'll be socially significant as well. You'll have massive passive income. And the biggest thing what you can enjoy is, what you can think about, what you can have is, you need not to bother about the legal consequences. You need not to bother about legal consequences, because integrative medicine, when you use your own Ayurveda medicine and in certain areas collaborating with the other experts of the other medicine, the legal consequences, you'll be what you call shielded against any legal consequences. Okay, so that is why you need to think about practicing an integrative medical medicine. And the third reason why we need to think about integrative medical practice is to come out of the shadow career what we are having with our BMS degree. We are having BMS degree, but we are practicing most of us who practice only purely allopathic medicine. Rather than practicing purely allopathic medicine, if you, with the allopathy knowledge, what you are having, already allopathy medicine, what you are practicing, with that, if you combine your Ayurvedic medicine, your Ayurvedic procedures, Ayurvedic principles, it becomes an integrative medical practice, and where you will not suffer with this shadow career. Okay, so we are now supposed to think from getting from the mediocre to abundance lifestyle. That transformation we require, because ultimately, as I always I claim, I tell that the life has got 4 stages. There is scarcity, survival stage, third stage success, and fourth is significance. And always this the mission or the vision of the Ayurpreneur Academy is to create significance stage for all the Ayurveda professionals. So if you want to be significant, if you want to achieve the per location, if you want to be irreplaceable in the market as a health expert. Okay, health expert, you need to be significant. So to have this transformation, what we are doing now with the conventional medical practice, especially the cross practice of allopathy medicine, okay, general practice, it is not possible to become significant, to achieve that success, where you will become irreplaceable, where you will be enjoying a blue ocean, where there is no competition, lot of opportunities are there. Okay, so this is not possible to conventional medicine, medical practice. This that it will not expedite the transformation from your survival to the significance level. You won't get that professional significance. You won't get the social significance. Even though you're a doctor, you will be regarded doctor. But at the end of the day, what the significance you deserve, you need to have, that you won't get. Okay. Moreover, lifespan is very small. We live, average lifespan is 72.5 years for an Indian as per the researches. Okay. So the last 10 years you leave it because it will not be productive. And already the whatever the life you have spent, that you may not have achieved anything. The remaining whatever the productive life you are having in that, do you think that with a conventional medical practice, you are able to accomplish whatever you want to have in your life? The social significance, especially I'm taking professional significance, financial abundance, and time freedom. I don't think it is possible with conventional medical practice. We need to think differently. And we have got an advantage. We have got an advantage of being an entrepreneur. Entrepreneur doesn't mean that you need to have a business. Entrepreneur means you have got the opportunity to present yourself in a unique way with unique solutions for the what you call the burning problems of the world, especially health problems. Because the entrepreneurship, when you present yourself as an entrepreneur, you got an easy attention, you'll get an early attention in the market, and you'll stand out of the competition, and it will help you to grow exponentially. As Zig Ziglar says, you'll be top. You'll be at the top. Okay, you can control your own destiny. Okay, especially when health sector is the top niche for the entrepreneurship, and when we can combine our Ayurveda knowledge with the integrative medicine, definitely we can make our entrepreneurial journey more abundant and more pleasing, and with more freedom of time and finance. For that, I congratulate you for being in Ayurveda. Okay. So, because the Ayurpreneurship is the new perspective, what we should think about. And when I was going through this Ayurpreneurship, when I was creating this particular concept of Ayurpreneurship, the first thing what strike to my mind was integrative medical practice. You can see the 7 entrepreneurial opportunities, what they could come to my mind as per my experiences, where our Ayurveda people can make their what we call the entrepreneurship. The 7, the integrative medical practice, exclusive Ayurveda specialty, Ayurveda lifestyle coaching, Ayurveda startups, tech-driven Ayurveda services, Ayurveda Ahar and agriculture business, research, academics, and authorship opportunities. These are 7, the broad what you call the arenas, domains where Ayurveda entrepreneurship can be started. And the first what which struck to my mind, which struck to my mind was integrative medical practice, because most of us, most of our friends, most of our colleagues, other people, they are already practicing allopathy medicine. Switching from allopathic medicine to the Ayurvedic medicine, it is very difficult for them who are already in the journey of the allopathy practice. They can make an integration. They can introduce a certain amount of Ayurvedic knowledge into their clinical practice, already running practice, so that they can create their own what we call the specific branding, marketing, where they can stand out of the competition. With this reason, the integrated medical practice happens to be most important. Okay. Now, how we'll approach this particular setting up of the Ayurpreneur ecosystem of integrated medical practice in this particular session? So I'll be going through this particular, we'll approach with this particular 7 points. One is how can we define it? What are the concepts and principles of integrated medical practice? What is the market size and opportunities for integrated medical practice? What is the business model we should adopt? What is the competitive advantage we can have? What are the prerequisites, skills and tools and other resources? And 7th, what are the actions and projected results we can have? Okay. So there are different streams of medicines are there in the world globe. Conventional medicine is always referred as allopathy medicine because the different stream, the definitions and the categorization what has been made by the for the medicines is from the Western world. So for Western world, for them the conventional medicine happens to be the allopathic medicine, which is more of using medicine or surgery or some other what you call the radiation and other practices. Okay, which is more towards the symptom relieving. Okay, they are more focused on the symptom relieving. They are going to deal with the symptoms. The second is the alternative medicine. What they call the alternative medicine is which includes herbalism. What they call as an Ayurveda can be they name it as herbalism, and homeopathy, acupuncture, and others all other things. They call them as alternative medicine. A third, it is a complementary medicine, which is a part of allopathic medicine only, or the allopathic people or the Western science, what it believes in, like supplements, nutritions. Okay, all this they come under the complementary medicine. Okay, and functional medicine is which is based scientifically approaches or scientifically based approaches that focus on disease roots. Means functional medicine is more focused on the analyzing the root cause of the disease and then treating it and helping the patient to treat their illness. That is the functional medicine, what already Ayurveda speaks about. Nidana Parvarjanameva Sankshepada Chikitsa. Okay. And the integrative medicine is what is coming up is combining all of these. When they combine conventional medicine, complementary medicine, alternative medicine, or functional medicine, when all the four or three or two, whatever, depending upon the need of the patient, when they combine it, okay, then it is called as integrative medicine. Okay. So that is how the definition has been framed. So when they combine them, okay, different what to call the categories of the medical practices around the globe in the good interest of the patient to get to help the patient to achieve what you call the optimal health. Okay, when they use it in an appropriate way. Okay, when they partner with the patient to understand their needs and they educate the patient to understand their own physiology, their own pathology, and then they together when they make a planning of the treatment and what should be the management, then it becomes more holistic one. Okay, so it is in a philosophy. Integrative medical practices medicine is in a philosophy that neither rejects conventional medicine nor accepts alternative therapies uncritically. Means they critically analyze the complementary alternative medicine and then they accept the certain points which are they are convinced and they are combining it with the conventional medicine. Then they are calling it an integrative medical practice medicine. Okay, so the concept what it is, it will change. Okay, integrative medical practice will change you from symptom focused treatment to supporting the body to heal itself. That is the core principle of the integrated medical practice. That is changing your concept, your approach towards the patient from only focusing on the symptom to the treatment which is focused on the real means root causes and help and removing them and helping the patient to contribute his side, his part, okay, in healing himself from the inside. Okay, that is how it is the basic principle of the integrative medical practice. Means it's a more deeper way of connecting with the patient and helping the patient to come out of what you call the come out of their problems on their own. It is like do it yourself. It is like do it yourself. Okay. So the symptom based, the whole Western world is now looking for, rather than checking the symptoms, rather than treating the symptom, they are now focused. They know that now the symptom treatment is not going to help to achieve the optimal health. So now they are going for the root cause analysis and then removing the root causes. So that is what Ayurveda already has spoken about. Already Ayurveda has spoken about the hetu should be removed, nidana should be removed. Then only the optimal health can be achieved. So now that is the basic principle of integrative medical practice. And because of that, I felt that this integrative medical practice happens to be very near to our heart. It is very near to our core because we are already doing that. Okay. And it is booming in the Western world now. And they are now focusing on the overall health of the spirit, body, and mind, which is already explained in Trivida Chikitsa. Daiva which I call should be directed towards the spiritual healing. Yukti Apashraya is for body, physical pathologies. Sato Jaya is for mind. Okay. So the different spokes of the integrative medicine wheel is there. There is a uh, by William Coley has framed a integrative medicine wheel where he has included these spokes. Okay, which is most of the parts are from the allopathic medicine or the contemporary medicine, and in that he has put whatever is acceptable which can help from the alternative medicine. Okay, like surgery is already existing there, pharmaceutical drugs are there with them, and the nutritional medicine is there with them, and what you call the manipulative therapies are there with them, but are not having what you call the herbal medicine in them. They were not having the lifestyle and behavior medicine. They were not having body mind medicine, and they were not having energy medicine. Now they have included it. So that becomes an integrative medical medicine wheel. Okay. So example of integrative medicine, what they are looking for is like acupuncture, chiropractic, homeopathy, hypnosis, osteopathy, tai chi, yoga, and herbalism, what they call it is Ayurveda. Okay. So integrative medical practice, the concept which I was speaking about is when it is combination of conventional medicine, self-care of the patient. Patient is supposed to work on himself, and complementary health and alternative medicines are added. So then it gives an overall holistic result for the patient. That is what integrative health. Okay. So lifestyle medicine is there, integrated medicine is there, and that causes a good outcome, a holistic outcome, and 100 total, what you call the uh, total optimal health. Okay. So the allopathic medicine, the regenerative medicine, holistic medicine, naturopathic medicine, functional medicine, Western medicine, everything when it is combined in a proper way, in a good, proper, what you call the proportion, that becomes an integrative medical practice. Okay. The basic thing is that the patient has got his own role to play here along with the health caretaker. Because ultimately there should be alignment of spirit, body, mind, and what you call uh, the what you call the external environment. When all of these stay together, they mix, then it becomes a holistic approach. So there are different differences there between conventional medicine and the functional medicine now. So functional medicine as and now, that these are all interchangeably used words now. The functional medicine, personalized medicine, what you call the tailor-made medicine, okay, and integrative medicine. These are all alternative now, synonyms. We can use them as synonyms now. So what is the difference between conventional medicine and the integrative or functional medicine or the alternative medicine is the conventional medicine till today, it was focusing only on diseases. It was not bothered about the health, health as what you call the basic thing. As Ayurveda speaks, swasthasya swasthya rakshanam, atursha vikara prashamanam, which the swasthasya swasthya rakshanam was not in their card. Allopathy people, they never had that in their cards. They were only checking, they were only battling with the controlling the disease or curing the disease. Whereas the functional medicine, right from the beginning, says that prevention is better than cure. Even though all of Western world they says that prevention is better than care, but they are never focused on that. But that alternative medicine or functional medicine, integrative medicine, that focus on the health oriented. It is health oriented, means first preserving the health or improving the health, optimizing the health. Okay. The conventional medicine is more doctor centered. Doctor will prescribe, he will diagnose, he will assess, he will plan the management without considering without taking or not, without connecting most of time with the what you call the inner core of the patient, and because of that, it becomes a doctor centered. Whereas integrative medical practice becomes the patient centered. So ultimate large interest lies on the patient. Means the larger interest we should think about is the patient. Okay. The conventional medicine has got with the same medication for every patient. Same medicine. Isn't it? How many of you agree with me? We prescribe allopathic medicine when we prescribe, it's not any specific. The same antibiotic we use, same analgesic we use, same antipyretic we use, same antihistamines we use, same antacids we use, same antihypertensive we use, same oral hypoglycemic we use, or anti-diabetic drugs we use. It is not what you call constitutional based. Whereas our functional medicine or integrative medicine, what Ayurveda says, is a holistic one as per Prakriti, as per the different, what you call the patient. For each patient, the medication changes for the same disease it may be. Okay, conventional medicine is only specialized. Okay, and it is superficially deals with the diagnosis and symptoms, and the of course they may detect the disease early, but they fail in understanding the underlying cause of the disease, and biochemical individuality they do not understand, and preventive approach they don't have, which is with the functional medicine. Okay. So with this, what are the with the backdrop of this integrative medicine, what I now explained, and how it exactly it approaches, there is a huge market size for integrative medicine. There integrative functional medicine centers are there in the Western world. They are booming now. For example, the CJ Pabla, the MD, who is an integrative functional medical physician, they're called as integrative functional medical physicians. Okay, he says that the people in America are frustrated; they aren't getting better. As a country, we spend a lot of money on care for chronic conditions. See, the America is the one country which is spending a lot of money and their budget for the care, it means disease, to treat the patients of treat their citizens. Okay, the billions of rupees they are investing on the health sector because the country takes care of their citizen there in the America. There, the big chunk of their budget is going for health restoration of their citizen, but still they are not in success. Still, they stand at what we call 37th rank of well-being, well-being of the patients, their people. Okay, they stand at 37th rank in the world, being the very most powerful country in the world. At the health, when it comes to the healthiness, health of their citizen, they stand, the well-being stand, they stand at 37th rank. Okay. So because of this person has made this particular observation, we should be spending more money on preventive care. See what they are looking at. They are now switching over to spend their budget on the preventive care. Okay. So we are great at keeping things in check, but not curing the disease. Okay. So they are thinking the changes. So that's why the integrative medicine happens to be the futuristic medicine. Futuristic medicine, which includes conventional medicine, complementary medicine, alternative medicine, as per the Western country. But at the end of the session, I will make you to understand the Ayurveda itself, only if you use Ayurveda itself in toto, okay, different aspects of the Ayurveda, principles of Ayurveda, you can make your own integrative medicine without taking help of the allopathic people or the other, what you call these experts, to make it an integrative medical practice. For them, integrative medical practice is their conventional medicine along with the complementary medicine, the alternative medicine. For us, we do not require this one when it comes to the chronic disease I am speaking about. Of course, life-threatening disease, acute disease, allopathic medicine is required. I do not deny that. But when I am speaking about the integrative medical practice, holistic health I am speaking about, especially Swasthya Rakshanam, only pure Ayurvedic practice can be a holistic medicine for or foundational functional medicine for the whole world. Okay. The market size, you can look at the market size. See, whole Asia Pacific and African countries, they are already looking for the integrative medical practice, medicine. Okay, they are looking for integrative medicine. Rising adaptation is there for natural remedies. Okay. So already the global market size share is, okay, the botanicals, that is herbalism is a major chunk. You can see on the right hand side here. Okay. So body healing is the next one. Next, followed by mind healing, followed by external energy, followed by sensory healing. So different healings, that different level, the healing is being to taken place. Okay. So either you call it as a precision medicine, or whether you call it as a global complementary medicine, or whether you call it as a personalized medicine, everything remains same. That is integrative medical practice. See at the what the projected rate of the market size. In 2018, the global precision medicine market was only 43.98 billion US dollar, which is going to swell to or surge to 86.25 billion US dollar by 2025, almost double. with the CAGR at the cumulative annual growth rate of 10.1%. Another research shows that 55.2 billion US dollar was there in the 2018, and it is going to be 163.3 billion US dollar by 2025 at the CAGR of 16.8%. Okay, CAGR of 16.8%. And third study says the same thing, that the whatever it was 2017, it was 1,577 million US dollar. It is around $15.7 billion US dollar. It is going to be 34.6 billion US dollar by 2024. Okay, by the rate of CAGR 11.9%. And the corona has impacted more. Because of that, we could get the recognition in whole globe. See, now global Ayurveda market size also blown up. That is the impact of the COVID-19. The global Ayurveda market size in the year 2021 was 8.83 billion US dollar. Now it is expected to be 28.23 billion US dollar by the end of the 2029. The major the target market can be the North America. Of course, 80% of the Ayurvedic market is in India only, but still the projection says that they are showing that North America can be the biggest market for Ayurveda, followed by Europe, Asia Pacific, Middle East and Africa, and South America. Okay. This articles also show the same thing, that post-COVID, there is 50 to 90% growth of the Ayurveda market, Ayurveda products, Ayurveda wellness. So that you need to think over. And whatever the Western world is looking towards as an integrative medicine, ultimately it comes and stops at Ayurveda. Because even though they may be still not able to take out their whole allopathic medicine from the healthcare system, but the patients, they can travel to India in the medical value travel visas to have the Ayurvedic treatment, which happens to be most holistic treatment, because it analyzes all the things, that it treats the root causes, it is holistic, it is functional, it is personalized, it is patient focused, and it is natural. That's why Ayurveda happens to be the most lucrative and most, what you call, the judicious, okay, most judicious integrative medical practice. The whole world now, with the green, whatever you're seeing on the map, all those countries are looking, they are accepting, they have said yes to traditional and complementary medicine. And the good news is that we have got the WHO Global Center for Traditional Medicine in Jamnagar in India. That is the biggest advantage what we can have to promote ourselves and restore our faith and hope in Ayurveda, and create our own alternative revenue sources, streams, by using Ayurveda or incorporating Ayurveda in your clinical practice as an integrative medical practice. Okay. Because see, there is integrative medical, what they are following? They are following the 5 models of integrative medical practice. The Western world is following 5 medical models of the integrative medical practice. The consultative model, where they are giving expert opinion, they are getting the expert opinion from the other experts of the other medicine streams. For example, allopathy medicine physician, if you want some Ayurvedic expert opinion, he will be taking Ayurvedic expert opinion. That is a consultative model, as we do. We do it in the India. When we want, we have the opinion from the experts from the allopathic side. But it is not vice versa in India. Allopathy people are not taking in the same ratio as we take expert opinion from them. They don't take expert opinion from us. That is the scenario we need to change. Okay, the consultative model is the one which the integrative medical practice has got. First model. Second model is collaborative model, where there is an integration between the doctors using a common platform. Means it is a collaboration among the doctors to help the patient. Third is a coordinated model, where the integration through care coordinator. Means there will be a dedicated care coordinator will be there, who will be collaborating, who will be connecting with all the people who are involved in that integrative medical practice, means integrative health care planning of the patient, and that how it works. Fourth one is the multidisciplinary model, where they'll be implementing the outcomes of all the collaborative model, which will be highly articulated and formalized by the coordinated practice. Means both, that is collaborative model and coordinated model, then they are clubbed together. That becomes a multidisciplinary model. And fifth one is the interdisciplinary model, where it will be the different people from different expertise, they'll come together, they plan together, and then they will have a common what we call the management system, management planning for the patient. That is called as interdisciplinary model. In India, currently, what we are doing? We are doing two models. We are for practicing two models in the medical practice, especially when it comes to integrating part, when comes to taking help of the other medical experts, other stream of experts. That is, one is a referral model. We'll refer them. We'll refer to the other expertise, other medical field or other medical stream. And from there, either patient will be getting expert opinion or the patient will be taken care by the other person. And second is a parallel model. Parallel model is allopathic medicines are also going on. Ayurvedic medicines are also going on. Homeopathic medicine is also going on for the same patient, for the same, for either for the same problem or for the different problem. That is a parallel model. Okay, that is what is happening in India. We need to switch over to what? The interdisciplinary model. We need to switch over to either collaborative model, which are above. Okay, in the integrated medical practice, which is the Western world is practicing. Okay, so the integrated medical center, the model, what they call now, the whole world, the Western world is coming up with the integrative medicine centers. Okay, where they include all these things. With the allopathic medicine, they may include the what you call the other complementary medicines, alternative medicines, like nutrition, exercise, rehabilitation, acupuncture, massage, psychiatry, cognitive behavior, then meditation, yoga, tai chi, music therapy, everything, whatever is available, which can be compatible for them, they are using it, and they are making it a center where under one roof, every streams of medicine can be clubbed and can be used. Okay, and it can be clubbed properly to have the optimal health, to come to treat by treating physical, psycho-spiritual, and social aspects of the patient. Okay, so what are the type of the five types of models we have seen? Let us see what are those things. Okay, so the first one is the, as I told, consultative model. In the consultative model, again, there are five types of the consultative models are there, consultations are there. That is Scott Davis, Pendleton, Roger Neighbor, Cambridge Calgary, John Heron. Okay, these are the five models, which the RCGP comes under the Pendleton model only. Okay, so these five are the consultative models. So what does the Stott and Davis model says is, Stott and Davis model is what the basic Ayurveda says, the same thing they are following now. They are going to identify the management of the presenting problem. Then they modify the patient's whatever the things are supposed to be modified, and they say the what the patient is required. They suggest those modifications, okay, in their behaviors, or educating the patient to understand what the diet they should take and all things. And third is they then focus on what are the problems, real problems that are existing with the patient at present. They will manage that one, and then they will promote the health, opportunistic health promotion. That is, in future, the same patient should not suffer with the same problem, like vaccination, cervical screening, all those opportunistic health promotions they are going to do. So first is for the problem what they have come. First, they will identify that problem, then they'll manage the present problem. Then they will help the patient to understand why it has happened and how they are supposed to correct. Third is they will help by their own medicine and the therapies. And fourth one is they will suggest some what you call the prophylactic methodologies to promote the health or take care of their health. Okay. The second model in the first consultative model is, second type is Pendleton's model, where again the same thing is there. They will identify and manage the presenting problem again. Okay, they define the reason for the patient attendance. Then the doctor will consider whether there are other problems. For example, any relevant health promotion issues are there, whether there are any at-risk factors such as social problems, means other aspects of the other than the main complaint, the associated complaints, and their relative reasons can also be traced upon. So doctor and patient will choose an appropriate management plan together. So this is the important thing about the pendulum's model, where patient will be taken into consideration. Patient will be given the options to choose from the available medication or available therapies for himself. So they'll arrive at a common, what you call the management plan, by understanding what is required and what will be better for them. And there will be a mutual consent will be there to take care of both the aspects of the doctor as well as the patient. Okay, that is Penland's model. Third is the Roger neighbor model, which I was speaking about. It is like connecting the patient. First, you need to connect with the patient. Okay, you need to connect with the patient. 5 stages are there in the Roger neighbor model. The first one is the first stage is the connecting with the patient, understand the patient. Okay, develop a rapport with the patient. Second is summarizing the opportunity for the doctor to ask whether whatever he has noted down from the patient, whether it is he need to read it back, and he should get a consent from the patient that whatever the problems they were trying to tell or they were expressing, all the problems have been covered or not. Third is the handover. Handover is patient is taken to confidence, and patient will be patient will be what asked to help the doctor to formulate the management plan together. Fourth is safety netting, wherein consultation and contingency plan is formed. Safety means even many times it goes wrong. Many times some ill events may happen. So in that time, what the responsibility of doctor will be, what the responsibility of the patient, everything will be decided on a legal basis, and safety will be assured for both of them. Then fifth one is the housekeeping, okay, which will be with the which prompts the acknowledge and deal with any emotions arising from the what you call the consultation before the other patient. See, doctors are also human beings. When they connect with emotionally with the patient, what happens? They may get into the involved with the same patient, and it may affect the treatment planning for the next patient. So the doctor should establish or the doctor should exhibit the compartmental behavior. That is what the Roger neighbor model stresses upon. You need to have attachment and detachment with the patient as per the requirement. Okay. And the next model is Calgary-Cambridge model, where is there are 5 stages again there. That is initiating the session, means consultation session, then gathering the information, physical examination, explaining the explanation and planning, and then closing the session with the treatment plan. So it gets to what you call providing, it has got a different structure, and it will help you to build the relationship with the patient. So that is Calgary-Cambridge model. And the fifth one is John Heron model, wherein it is prescriptive, where it helps the patient to understand his behavior and what he has supposed to follow in the treatment and the follow-up. Informative, patient will be given the required knowledge, information about the disease, information about his own system. Confronting, where the patient consciousness supposed to be taken into this one, patient will be made conscious about the limitations of the treatment. You cannot guarantee, you cannot 100% claim that you are going to give 100% result. If their limitations are there, that should be honestly discussed with the patient. Patient should be aware about the limitations of the available treatment. Then only patient will not complain about you, even if the result is not what you call the achieved. So never overpromise. Never overpromise. Be realistic. Whatever is possible, you be honest and open to that. Okay. Cathartic is which will help the patient to abstract painful emotions. So you are connecting with the subconscious mind and emotional mind, and you are trying to remove their emotions. You are trying to remove their emotions. Okay. And catalytic, which will help the patient to discover self. Patient will, when they discover their self, they are more open to cope up with you, and they will be more open to plan the treatment for themselves. And the fifth one is supportive. Okay, so sixth one is supportive, which will affirms the worth and value of the patient. So you need to be supportive. Patient should be supportive doctor. So that is John Heron model. Okay, so that is about the consultative model. Consultative model has got these. Ultimately, what happens? You need to, the basic core idea is you need to connect with the patient at the emotional level and understand what is his pain. And for that, you need to treat and take him into confidence and help him to heal himself. The second model of the integrative medical practice is the collaborative model, where There will be care manager will be there, a dedicated care manager for the patient, who will be collaborating with the therapist, the decision support team, and the primary care provider, and he'll be means planning all the thing for the patient, and accordingly the treatment, the patient will be given a holistic approach. Third is the care coordination model. Care coordination model is again collaborating everyone. The whole team will be working for that, where the basic thing will be as access to care the patient will have. There will be evaluation, there will be diagnosis, there will be care plan, then there will be education of the patient, care of the patient. Once the patient is healed, follow-up will be taken. So it is a total, what to call the overall care of the patient. That is care coordination model, where there will be a dedicated care coordinator, or care coordinator will be there, who will be following up throughout the patient as long as he is subscribed to that particular center. Okay, it is a lifelong relationship, which can provide a primary care, which can provide a specialty care, which can provide a hospital and post-acute care, which can give house calls, which can provide the urgent care, and which can help them to get the health coaches and restore the health and disease and care management. So this is all the patient needs are taken care by the coordinator. Okay. The fourth one is the multidisciplinary model, where the nurse, doctor, dietitian, physiotherapist, social worker, so any people who are there who are required for this one, all of them, they will be contributing their side, their expertise, and that will help the patient to get the maximum benefit, and there will not be any shortfalls to achieve the health. That is multidisciplinary model. Okay. And interdisciplinary model is more what you call the approachable, more practical, wherein the multidisciplinary model, what happens? Everybody is acting parallelly. Okay, dietitian is giving his own part, physician is giving his own part, surgeon is giving his own part, physiotherapist is doing his own part. They are not collaborating and they are not making a common plan. All are acting parallelly. That is multidisciplinary. Whereas interdisciplinary is they sit together, then they will make addition, deletion of their all individual plans. They make a common plan, which becomes a problem solution for the patient. Okay. So multidisciplinary is, as they are working parallelly, they work sequentially, and everything depends upon the medical requirements. They will be only giving out in the prescription. Whereas interdisciplinary is, they work collaboratively, and they sit together literally to make a care planning, and then they execute it. Okay. So that is all about the integrative medical practice, the models and how it is practiced. Now, how it can become a competitive advantage for us. This is the biggest, this is the more interesting part of which we are supposed to think about. How we can make advantage of this the growing interest of the Western world towards integrative medical practice. That is what the competitive advantage we are having as Ayurveda professionals. Okay. So what do you think? Whether we can make an advantage of this one? Whatever the growing craze or the growing need or growing interest of the Western world or rest of the globe towards integrative medical practice, whether it is really going to help us to make our own, what to call the, our own position in the market, or whether it will help us to position ourselves in the market. What do you think? Yes or no? You can type in the chat box. What do you think? Whether as an Ayurveda professional, we can make our own positioning in the global market, health market, as an integrative medicine expert. Yes or no? Type in the chat boxes. If you agree with me as yes, if you do not agree with me as no. But as for me, it's a big yes is there. Big yes. Big yes is there. Because see, already we have got all those things in our classics, in our teachings, in our learnings. Okay, which can contribute to create a very good holistic medicine. Very good holistic medical planning for the needy patients, especially for the lifestyle disorders, chronic disease. We have got the Swastrata knowledge. We have got chakra healing. We have got marma chikitsa. We have got nutrition diet. We have got medicinal management and panchkarma. We have got rasayana vajikarna. We have got Ratna and Upratna knowledge. We have got knowledge of mind, soul, and Indriyas. We know preventive medicine in the form of Adharni Vega, Dharni Vega, Viruddhahara, Dinacharya, Rutucharya, Sadvrutacharna. We have parasurgical procedures. So that is an advantage what we are having as an integrative medicine practitioner or holistic medical practitioner as a rather. We can call it as a holistic medical practice because we have got all those things which is required for any problem in the world. Okay. Because see at the left hand side, the biological medicine, what the integrative medicine, what they're speaking about, what they are speaking about alternative medicine. They are speaking about biological medicine. They are speaking of conventional medicine. They are speaking about emotional therapies. They are speaking about spiritual practices now. Okay. So psychology, conventional medicine, alternative medicine, spiritual medicine practices, emotional therapies, energy methods, holistic therapies, nutrition supplements, natural medicines, mind body medicine, counseling, stress management, consciousness awareness. So all of this, don't you think that these are all included in our Trivida Chikitsa? Yes or no? They are included in our Trivida Chikitsa. Daiva Pashraya, Yukti Upashraya, Sattva. Daiva Upashraya is for in tissue medicine, in tissue problems. It's a spiritual therapy. Okay? Which is for inherited, congenital, idiopathic disease. We can use Daiva Upashraya Chikitsa. We can use Yukti Upashraya Chikitsa for physical, dosha, dhatu, mala, if they are imbalanced, because that there is a, what you call the pathology. So these elements can be equalized, equilibrium is brought, and Yukti Upashraya can be the physical elements. For physical elements, Yukti Upashraya happens to be the best treatment. And emotional and psychological problems, we have got Sattva Vijaya Chikitsa. Isn't it? So psychological illness that require correction of the manas doshas through NLP, you can do it, the neurological program, that is Sattva Vijaya. So now, directly you can say now, integrative medicine is nothing but Trivida Chikitsa. Because whatever they are speaking about integrative medicine, the approach what they are having now taking up, that all comes under Trivida Chikitsa. That's why it is a integrative medicine. Okay. So what are the prerequisites now? Already you are having all those things for you with you, all the resources you are having, all the tools you are having, all the skills you are having, but still I would like to emphasize on what is required. So the skills you need to acquire is, if you don't know yoga, you should know a little bit of yoga. You can have marma point manipulation techniques. You can know meditation techniques for chakra healing. You need to understand neuro-linguistic programming to use Sattva Vijaya as one of your major chikitsa. Panchakarma already you people know. Parasurgical procedure you can have if you are dealing with a particular problem which requires a parasurgical procedure. Kriyakalpas, Shashtipakramas are there, and astrology, numerology can be taken into consideration for the Ayurveda Chikitsa, which is at the spiritual level. Okay? Because what the modern integrative medicine medical practice says, modern integrative medical practice, it says that there is at two level the treatment should be given. At two level, particular help should be made from the healthcare. One is energy level, another one is physical level. So energy healing comes at the spiritual level. Okay, at spiritual level and mind level, that is energy healing. So energy healing is with hands. They are doing with a Reiki, pranic healing, therapeutic touch, healing touch. At the mind and brain, they are doing hypnosis. Okay, EFT. Okay, EFT, tapas. At energy level, physical level, yoga, tai chi, qigong, they are using. They are using acupuncture with the tools. Okay, light and color therapy, far infrared therapy, vibrational healing, inferential therapy, emergency remedies, homeopathy, essential oils, and flower essences. At physical medicines, the biological medicines, they are using nutrition, supplements, herbs, they are using hands-on chiropractic, cranial sacral therapy, physical therapy, cupping, massage, everything they are including. So we have got all those things. Okay. So what we can do is, we need to think out of the box. Already we have got everything in there with us, and it's a time to make your own, what to call the treatment protocol or what you call the treatment planning as a holistic plan for the particular disease you want to treat. So then you need to finalize what the action you need to take now. If you want to be a brand, if you want to brand yourself, position yourself as a holistic health expert, it's nothing but an integrative medicine practice, you need to finalize your micro niche, which particular disease you want to help. Don't be general. Okay. If you become general, you will not be serving anyone. You need to be specific. Identify one problem, and for that you plan what can be the best holistic approach using all the knowledge what you are having with Ayurveda. Okay. And that will decide your what you call the entrepreneurial journey. That becomes your entrepreneurial journey for integrative medicine or the holistic medicine. So once you finalize that micro niche, do the research, assimilate the concepts, acquire the required skills, about the tools and procedures which may you require to solve the problem. Then establish your brand accordingly and your authority in the market. Present your position yourself as a holistic expert from Ayurveda. Okay. Then start helping the patients. Get the results, document them, get the testimonials, analyze them, improvise them. Then expand and scale up your business, your particular what you call the healthcare system. And by that, you'll be able to establish your own ecosystem in the integrative medical practice within next 10 years to have time and financial freedom. Okay. So some of the disease I would like to enlist here, which you can focus on. Other than this, lot of things are there you can look into. But as a broader this one, you can think in these lines so that you can get which is very much close to your heart, where you have got more skill, where you have got more expertise. There you can go through. So thyroid disorders, other hormonal diseases you can take up because they are swelling up in the market. The whole globe is suffering with those things. Every alternate female is going to suffer with thyroid disorder. Gut disorders like IBS, reflux, IBD, ulcerative colitis, Crohn's disease, leaky gut, autoimmune conditions like Hashimoto's disease, rheumatoid arthritis, lupus, erythematosus, multiple sclerosis, alopecia, chronic spine disease and arthritis, chronic fatigue syndrome, metabolic disorders like diabetes mellitus, okay, thyroid malnourishment, palliative treatment for the carcinomas, geriatric problems like insomnia, constipation, Alzheimer, Parkinsonism, dementia, prostate. Again, number of diseases are there. Vata Vyadhi like Pakshagata, Sandhivata, infertility in male and female, skin disorders. In everything, you can approach with an integrated medicine, integrated approach, and you can make a good results. Okay. Now, who can practice integrated medicine? You need to have 3 essential attitudes. If you got these 3 essential attitudes, you can become a best integrative medical practitioner. The first element attitude you need to have is time to listen. You should be a patient listener. Patient listener to listen the patient. Listen to the patient. You need to dig into that. You need to dig into the pain of the patient, emotional pain of the patient, so that you can easily make out what is the root cause. Because most of the present day diseases are psychosomatic. So you need to dig into that. Second, the basic attitude you need to have is focusing on the root causes. Don't treat superficially. If you have got time, you have got that knowledge, if you have got that intention to help the patient by clearing his root causes, you can be the best integrative medical practitioner. Third is as using the most natural therapy means using the most of the Ayurveda. If you got these 3 attitudes, time to listen to the patient, focus on the root causes, means clearing the root causes, focusing on clearing the root causes. And if you are intended to use most of the Ayurveda, you can be the best integrative medical practitioner. And all the Ayurveda graduates, I believe that who are already practicing in allopathic general practice can also come back and they can include along with their allopathic medical practice, they can add on the Ayurveda medical practice, so they can become a true integrative medicinal practitioners. Okay. If in your family already the other experts are there from the other different medical streams, you are blessed to have them in your family, and you can start an integrative medical center along with them. From Ayurveda part, you will be doing justice. From other streams, they will be doing their expertise, they will be doing their own, what you call the professional contribution. The Ayurveda professionals who are open to collaborate with other professionals of other medical fraternity. If you are open to collaborate with other medical practitioners, other fraternities, you are also can be start an integrated medicine center. And Ayurveda professionals who have expert knowledge of other alternative sciences, like if you are already having other knowledge, expertise, if you are skillful in other what you call the sciences like naturopathy, yoga, acupressure, acupuncture, Reiki healing, crystal healing, gem therapy, NLP, you can start your own integrated medical practice. Okay. But still, the challenges are there. I don't say that it will be a cakewalk, a smooth walk for you people. There will be a challenge. The challenges are there because see, still it has not gained. Okay. Still not gained. The standardization are not, the regulations are not there. The regulation standardization is not still very much clear. So that can be this. So that's why when it comes to collaborating or using yourself using allopathic medicine along with Ayurveda, that becomes a problem where the regulations are not clear. They are not standardized. For that reason, if you are using only Ayurveda and other supporting or auxiliary Ayurvedic principles like naturopathy, yoga, gem therapy, crystal healing, then there is no issue of any legal consequences. But when it comes to using allopathic medicine or homeopathic medicine along with your Ayurvedic medicine, then there are little bit challenges you may face. But if you collaborate with the allopathic expert, that challenge can be taken care. And there is a less awareness in the market, especially in India, or go for holistic approach. So that can be the biggest problem for us to start in India as an integrative medical center, because acceptance is still not there, because people affordability also counts. People affordability is another big thing in India. They are ready to pay at 5-star hotel, but they are not ready to pay for their health at a medical center. So that is the biggest challenge what you need to take care. Okay. So what you are expected to do once you, today, if you decide that you want to be an integrative medical practitioner, your aim, your result, your goal should be to become a member, consultant, or resource person, or partner with the international institutes and association of integrative, functional and preventive and personalized medicine center. Okay, there is a body called as International Institutes and Association of Integrative, Functional, Preventive and Personal Medicine. You need to aim to become a member of that particular society so that you can get a global identification, global reach, where you can present yourself and you can make what you call the monetization of your knowledge in a more better way. Okay. So I recommend for you to go through these, some of the already existing what you call the integrative medicine business model case studies are there. I can go through these things. That is Dr. Anshul Gupta from Delhi. He has got his own integrative medicine practice. Dr. Gupta, he is from modern medicine, but he is practicing integrative medical practice. You can visit his what you call the website. You can go through that. Dr. Gupta Functional Center. Dr. Gupta functionalcenter.com. So he is practicing as a functional medicine expert, functional medicine physician. Jindal Nature Cure Institute at Bangalore is there. You can visit that. You can see there how they are doing it. Vedanta Wellness in Gurugram, the Ayurvedic Village in Pune, the Art of Living Retreat Center at Bangalore, Apollo Ayurveda chains of hospitals are coming up with Raju Vaidya is there. He is the chairman of that, and they are really coming up very great in a very, very big. Okay, they are changing this what you call the scenario of the integrative medical practice. Okay, so you can visit ayurveda.com, where you can get more details about it. And in international level, the International College of Integrative Medicine is there, National Association of Integrative Medicine for America is there, National Center for Complementary and Integrative Health is there, National Institute of Integrative Medicine is there for again in America. Okay, it's not of India, it's of America. So you can go through that. So what I did was, once I went through all these things, I felt that there's a required need is there. That I wanted to help my Ayurveda friends. So I created one community, that is Ayurveda Lifestyle Hub community. In that community membership, I wanted to teach. I wanted to help our Ayurveda people who are the member of our Ayurpreneur Lifestyle Hub to understand the different spokes of the revenue generation of the Ayurveda medicine. So for that, I created a courses. In one of the course among them is the Integrative Silhouette Blueprint. Okay, Integrative Silhouette Blueprint, what I identified as the most needed one for the present day, okay, which I created, and it is a part of the main course of our Ayurpreneur Silver membership. Okay, the level 1 course where Ayurpreneur business model is there, which is a bundle I have created. In that, this happens to be one of the course, Ayurpreneur Integrated Silhouette Blueprint. Okay, I named the people who are going to be our Ayurveda people who are going to practice integrative medicine. I am certifying them if they are the member of Ayurpreneur Lifestyle Hub. We are going to certify them as a integrative silhouettes. Okay, we are the most essential people of the healthcare system. Okay, so there this course includes the other concept and essential elements of the integrative medical practice, 7 principles to repair the roots of the healthcare, jigsaw puzzle blueprint will be there, missing pieces in the wellness model is there, nitric oxide for restoration of blood flow, how it is going to help us to understand our rasayana therapy and how to think about monetization using Ayurveda as an integrative pivot, Ayurveda principles to support integrative medicine and making the creative money machine, Ayurveda without complex learnings and going beyond the wellness. So this is all included in the highlight of the silent features of this course. So this is a part of that. Okay. So this is one thing I would like to bring to your notice, that we have got the course for that. I am building this course. Of course, it is not live now, but this course will be very much live and very soon. So I'll be covering a lot of things so that the people who want to start their own integrative medical practice, they can go through this course and they will get more ideas and insights about. I believe that they'll give a more insight about the clinical practice. Okay. So if you found this session as valuable and you want to learn more, I request you to subscribe to my Ayurpreneur Academy YouTube channel. Okay, I'll be taking up the question and answers after this one. Meanwhile, I request you to scan this QR code, if it's possible, to subscribe to Ayurpreneur Academy YouTube channel, where you'll be getting lot of learnings. Many of the expert talks will be uploaded there in the channel, which are free to watch. Okay, they are not enlisted. So you can access them at any time. And if you become an Ayurpreneur Academy YouTube channel subscriber, you'll get the notification when and or I'll be introducing new ideas for the lucrative Ayurveda practices. Okay. Otherwise, you can directly search for Ayurpreneur Academy YouTube channel in your YouTube channel. You'll get that, and I request you to subscribe and promote it to all the like-minded people, all the Ayurveda people, so that we are going to build a community. And I also request you to, if join my Ayurpreneur Academy Facebook group, VIP Ayurpreneur Academy Facebook group, which is meant exclusively for sharing the knowledge of entrepreneurship and other clinical practice and lucrative medical practice of Ayurveda. Okay, you can scan this QR code and be a member of that Facebook group. If it is, even you can search Ayurpreneur Academy Facebook group, you will get access to that. So this was about the session. And to now, for the people who want to know much more about what is Ayurpreneurship, we feel that there are still a lot of things to be learned. Okay, for the Ayurpreneurship. Ayurpreneurship means what? Entrepreneurship using Ayurveda. That is the word what I have coined, Ayurpreneurship. So if you want to be the one of the new world of member of the new world of the Ayurpreneurs, if you want to know more about this, I would like to brief what exactly I'm offering, what I'm building. So I'm building a community of all the Ayurpreneurs who can collaborate mutually, who are going to collaborate mutually to help each other to grow together, so that they can establish their own Ayurpreneur ecosystem to achieve what we call the social significance, professional significance, financial abundance, and time freedom. So if you are interested to know, you can stay in the session. Okay. I'll be taking 10 minutes to brief it. Okay. So I have come up with a business model, that is Ayurpreneur business model, which is there are 7 verticals, as already I told you that the 7 verticals, we are going to promote these 7 verticals as an what we call the ecosystem, in the ecosystem model, where all the 7 experts of different, the 7 verticals, they will be helping each other, they will be referring to each other, the patients and the customers, and by that all of them will be benefited. So there is a mutual connection, mutual communication, what we call the collaboration is there. That is the business model, what is I call it the Ayurpreneur business model. So this is Ayurpreneur business model, where the people who are expert of either of any of these 7 will be helping each other. They will be supporting each other to grow together, to monetize the Ayurveda knowledge. That is the Ayurpreneur business model. Okay, so 7 streams of income. If you're expert, if you're well, means you are more efficient, you can be the expert of all the 7. You can have multiple streams of income from all the 7 what you call verticals. Like if you are going to be an integrative medical practitioner, you will be called as Ayurpreneur Integrative Silhotev in Ayurpreneur Lifestyle Hub, that is ALH. If you are going to practice only purely Ayurveda, you can be Ayurpreneur Star Vaidya. If you are a coach, you want to coach the people. By that you want to use Ayurveda to coach the people and help them to restore their health. Then you can be referred as Ayurpreneur Coach Reconnor in ALH. If you are having a startups ideas, you want to set up your own startups especially with the physical products. Okay, like a pharmacy, okay, or equipments, or instruments, or which are required for the Ayurvedic medical practice, or integrated medical practice, or holistic medical practice, you will be referred as Ayurpreneur Startup Frat. If you are tech driven, you are tech passionate, and you have got the knowledge to help the Ayurveda, any of these 6, what we call the your folks of Ayurveda ecosystem, that is Ayurveda business model system, you can help them by digital marketing. You can help the writing for them. Okay, you can help your technology to help them to automate their what you call the Ayurveda health centers or their businesses. And 6th, if you have got more inclination towards the Ayurveda farming, you will be called as Ayurveda Agri Hulk. And you can be raw material supply for the other 6 of these people. Okay, you can be what you call the organic providers. In turn, you will be benefited, and it's always win-win policy. And 7th is Ayurpreneur Author Genius, where if you are more interested for research, authorship, publications, from there also you can monetize. You can monetize. That is what we refer as Ayurpreneur Author Genius, which all these 7 courses are included, where you will get idea how to monetize your passion with Ayurveda. Your passion may be integrative medical practice, your passion may be Ayurveda practice, your passion may be coaching, your passion may be startup, your passion may be technology, your passion may be agriculture, your passion may be authorship. But all these passions can be satisfied, nurtured in the Ayurpreneur Lifestyle Hub. Okay. So we will be working on reprogramming your mindset, giving you clarity on the concept, helping you to have your own faithful plan. Okay. Will help you to upgrade your skill and achieve the competence, and will help you to provide a platform, a community, exclusive community of Ayurveda professionals as Ayurveda Lifestyle Hub, to collaborate with the other your folks, your colleagues, to build a ecosystem, okay, a mutual ecosystem, okay, so that you can have your own business model, win-win policy for all of us. Okay, so your roadmap should be, you should learn, you should upgrade your skills, finalize a niche, scale up, and set up your ecosystem. Okay, so if you believe in that the strength grows when we all work together, okay, then I feel that you should explore my Ayurpreneur Lifestyle Hub website. You go there, you'll be able to see how I could transform myself from an entrepreneur to an entrepreneur. I am already entrepreneur. I am a teacher in an Ayurveda college. So I am contributing for the growth of the organization as an entrepreneur. At the same time, an entrepreneur because I have become digital coach for all the Ayurveda pro professionals to help them to identify their core inner, what you call the expertise, and make what you call make the monetization money preparation. Okay. So for anything, you need a system. So the Ayurpreneur success significance triangle is you need to have three essential things. You need to have a mentor. How many of you agree with this? You need to have a mentor. Even till the lifelong, we need a mentor. We need a community to support our what you call the convictions, clarity, competency, confidence, and to collaborate with us. We need a system to guide us because people may fail, but system will not fail. Okay, so system is there. So the Ayurpreneur Lifestyle Hub is an exclusive community for Ayurveda entrepreneurs, which will be we are committed to build collaboration among the Ayurveda professionals for mutual growth. Okay, so vision is to empower Ayurveda professionals with concept, clear mindset, and competent skill set to build Ayurveda entrepreneurship. So I have created 4 levels of memberships. The bronze level membership is called as Ayurpreneur Silver Success Blueprint. The silver level membership is the level 1 membership is called as Ayurpreneur Business Model, and gold level membership, the second level membership is Ayurpreneur Business Mastery, and third level membership is Ayurpreneur Business Empire, that is diamond membership. The gold membership and diamond membership is still not alive, but the silver membership and bronze membership, they are alive. Okay, so how do we help? We help you by giving the different courses for your different needs. Okay, like Ayurpreneur Business Model, which I call it as an MBA of Ayurveda. Okay, Ayurpreneur Star Vaidya course, Ayurpreneur Coach Recruiter courses. So to satisfy or to support your any of these top 7 Ayurpreneur business models, we have got an Ayurpreneur flywheel method where the 6 steps are there to achieve your Ayurpreneurship. That is concept clear mindset, competent skill set, monetization on set, relevant time set, marketing tool set, and sales and service first. For that, you need 6 vehicles: that community, consultation, courses, certification, coaching, and collaboration. For that reason, the silver membership is going to offer you 3 life-changing benefits: that clarity, credibility, and cash flow. Okay, along with that, 6 C membership benefits are there: that is community access, courses, certification, coaching, consultation, collaboration. Okay, so once you become member of Ayurpreneur Lifestyle Hub, you will have a dedicated what you call the mobile app for your Android as well as your iPhone, Ayurpreneur Lifestyle Hub. Okay, which will have the constant courses will be there, your feeds will be there, daily learning will be there. You can interact with your fellow colleagues there. The video calls as it is going on now, the free video calls will be there. For every Friday, there will be coaching calls for you people, and live workshops will be there, and community access will be there. Okay, so this other than this particular mobile app, you will have the access to the Ayurveda business model, a 3-day foundation course, which I call it as the MBA of Ayurveda. The 3 days foundation course will be there. The basics of Ayurveda will be there. Ayurveda market analysis will be there. Basic entrepreneurship are included there. Niche and its influence for Ayurveda career is there. How to think about monetization using Ayurveda, and easy secrets to understand Ayurveda. How to create money machine with Ayurveda without complex learning is the silent features of this Ayurveda business model. Okay, the retail price is 14,999 at the website. Okay, along with that, we are giving bonuses. Okay, I am giving the almost 16 bonuses with this one course because, okay, so that is the first bonus is niche clarity blueprint, which is 9,999. Okay, which will help you to identify what exactly, which particular niche you should acquire and how you can advance in that. Bonus number 2, which is absolutely free with the Ayurpreneur business model, is the Ayurpreneur mindset mastery, because we are supposed to work on our mindset. Okay, so the different what the subconscious mind and how to master it, all those the things have been included in this one, and this is again 9,999, which is absolutely free with this one. So bonus number 3 is with the Ayur concept mastery blueprint, where I have made whatever I understood Ayurveda as a simple way. I have tried to make it the same thing for you people so that you can apply it in your clinical practice or your startups or your other Ayurpreneur, what you call the verticals, which is again 9,999, which is absolutely free with Ayurpreneur business model. Okay, bonus number 4 is their Ayurpreneur business blueprint, where financial aspects are being dealt, which is not being taught in the class institutions. So this financial planning, how to maintain the how to understand the account, how to maintain the accounts, how to develop, means identify and develop the multiple revenue models, all these things in the budget blueprint, the 4999, which is also free. Bonus number 5 is clinic setup blueprint, where the prerequisites to start your clinic at a very minimal investment, so that you can have 3x or 2x or 5x, depending upon your capability of the revenue generation from your clinics. That is 4999. It's free. Bonus number 6 is traffic building formula, how to increase the customer for what you call the number for your clinic or your product or your particular entrepreneurship. That is dealt in this. That is basics of the traffic building. That is 4999. That is also free with this one. And bonus number 7 is inner circle volt. So all the weekly calls, Friday weekly calls, all the expert talks, okay, all of them, they will be in recorded, there will be access for you for lifetime, which will be bonus number 7, which is worth of 29,999. That is almost 30,000 rupees per year. It's a subscription model, but still it is free with the Ayurpreneur business model as a bonus number 7. Okay, so bonus course number 8 is the integrated cellular blueprint, what I was speaking about now. That is 4999, which is going to be free and is a part of the Ayurpreneur business model. Okay, where the how to do the integrated medical practice, that is been dealt. Okay, then second bonus number 9 is Star Vaidya blueprint. So this is more focused on the how to set up an Ayurvedic, pure Ayurvedic hospital or clinic or wellness center. So that is also for 9999. The basic things, okay, they are dealt there, and you can, by that you can get an insight how to finalize your niche and how can finalize your lucrative niche. Okay, how you can monetize your knowledge. That is also free with the Ayurvedic business model. Bonus number 10 is Ayurpreneur coach recognizer blueprint. If you are very much, if you have got a very good coaching skills, you can become a digital coach and you can monetize your knowledge, Ayurveda knowledge, which how it can be done. That is dealt in the coach recognizer blueprint. This is 9999. That is also absolutely free with the Ayurpreneur business model. Okay. So bonus number 11 is startup frat blueprint. It is more about the business aspects. Okay. How to start a startup and funding and all those things, it come fall in that. So 9999 is the price, but it is also absolutely free with Ayurpreneur business model. Okay, bonus number 12 is the Ayurpreneur Tech Genie blueprint. So how you can, your technology passion can be monetized using Ayurveda or for the Ayurveda people. That is what I'm giving some of the ideas, even though I'm not tech savvy, but still I have got, once I means the whatever the research I have made in the market, I could make a draw some of the ideas, lucrative ideas, how our the Ayurveda students, Ayurveda professionals who are passionate about technology, but by chance they came to Ayurveda, but they are still having the passion for the technology. They can club their Ayurveda knowledge and technological knowledge, and they can give some of this, can have their own startups or some service providing, what you call the firms, means what you call the companies they can build, okay, to help the Ayurveda doctors. Okay, that is bonus number 12, which is 9999. Again, it is free with the Ayurveda business model. Bonus number 13 is Ayurpreneur Agri Health Blueprint. Okay, so the basic Ayurveda farming, seedlings and soil science, medicine, herb entrepreneurship, niche and its influence for Ayurveda career, all these things are included in 9999. These courses are still building. Okay, they are not live now at present, but they will be part and parcel of the Ayurveda business model once they become live. Okay, so this is also absolutely free with that. Bonus number 14 is Author Agile Blueprint, more towards the how to monetize your authorship, what you call the passion, authorship passion. That is 9999. That is again free with this one. And bonus number 15 is Ayurpreneur Success Blueprint, where it is the subtle elements of the entrepreneurship, and how the entrepreneurship is been dealt there. 16 modules are there, pre-recorded videos are there. So whatever the courses I'm showing you, all are there pre-recorded videos. They have got lifetime access for you people. Once you join Ayurpreneur Silver membership, a community membership I am offering. I'm not selling the course. I am offering a silver membership for people. So once you become a lifetime member of the Ayurpreneur Lifestyle Hub, okay, you will have access for all these courses. Okay, that is 17, almost 17. One, the main course Ayurpreneur business model plus 16 bonuses. So almost total 17 courses are there. So this is also retail price is 4999. This is also free along with the Ayurpreneur business model. And Ayurpreneur bonus number 16 is device goal setting formula, because all of us, we suffer because we don't have goals. We don't have professional goals. We never set the professional goals at the college level, or not even at many junction of our life. Because of that, we don't have direction. Because of that, we do not we do not become successful as per our capabilities. So this is a device goal setting formula is do yourself. You can decide yourself what will be your goal. And I am giving a formula using numerology, your personal quotients, and your subconscious beliefs. You can try it. You can prepare your own goal setting, and that is 4999. This is a unique course what I have created, and this is going to help you understand yourself and what you need to work on. So this is also free along with the Ayurveda business model. So once you go through the Ayurveda business model, what are the confusions, no goal, incompetence, scarcity, if you're suffering with all of these, survival mindset, insignificance, no time freedom, no passive income, no legacy, you will have clarity. You'll have goal for professional goal setting for your professional goal setting, as well as personal goal setting, family goal setting, financial goal setting. You will be there. You'll have competence. You'll have abundance. You'll have success. You will enjoy the significance. You will have time freedom. You'll have passive income. You will have ecosystem. You will have legacy to set if you put all your efforts as per our guidelines. Okay. So the Ayurpreneur ecosystem setup journey is understanding the entrepreneurship, analyzing your own personal and professional goals, then attending the monthly or to the Ayurpreneur mastermind sessions weekly now. Okay. If you are silver membership, it will be weekly. If you are bronze membership, it will be for monthly. Okay. Monthly one access will be there. For silver membership, weekly one mastermind sessions I'll be doing. Okay. At least average 3 per month will be there. So you'll be having access for that. So you'll have continuous learning. You'll have continuous learning. Okay. And then fourth is you'll be joining Ayurpreneur Lifestyle Hub. Fifth one, becoming an Ayurpreneur starter. Then participating in the Ayurthon. So that will be taking up a challenge and you'll trying to achieve that challenge so that you can make a milestone, achieve a milestone. So once you achieve a milestone in 90 days, then your next stage is to become Hall of Fame as per the criteria. It will be set by the Ayurpreneur Lifestyle Hub. And then 1 crore champion, then 10 crore club member, then your own Ayurpreneur ecosystem in 10 years. So the total plan is for 10 years. It is not a sprint, it is a marathon. I am also in the same journey. Okay, I have started my journey, and I would like to invite all of you to join me in this journey. Let us try, let us do, not try, let us do it together to achieve our own, setting up our own Ayurpreneur ecosystem in next 10 years, which will give us time freedom, financial abundance, social and professional significance. Okay, social significance. With recurring, the aim is to, because we need to have a tangible goal. We need to have a tangible goal. Okay, more specific goal. So let us decide that we'll have a recurring revenue of 10 crore rupees per annum in the next 10 years. Okay, so if you are interested to go for this journey, I am going to offer you this Ayurpreneur business model silver membership, which will give you what you call lifetime access for all these 17 courses worth rupees 1,39,983. Okay, so already I am telling you that there is the total value of all these courses 1,39,983, but I am giving the 16 these bonuses right from the Ayurpreneur niche clarity blueprint to Ayurpreneur device goal setting formula as a bonus courses. So the main course, the Ayurpreneur business model, the flagship course is 40,999. That is almost 15,000 rupees for lifetime access. With this course, along with these 17 courses, along with a dedicated community Ayurpreneur Lifestyle Hub membership for lifetime and weekly calls to nurture you and help you to understand the different aspects of the monetization of the Ayurveda, okay, and legal aspects of the Ayurveda, okay, and other new what you call the understandings as per me and I'll be inviting other different experts for this weekly talks. You can have access for them also, okay, and we are going to have the challenges, Ayurthon challenge. I am planning for that also, so that you'll be having a challenge for 90 days where whatever the niche you decide, whatever the vertical you decide to achieve, will be helping you to achieve that in 90 days. So accordingly, I'm planning it. So, okay. So very soon it will be live. The challenge will be live. Okay. So all these things, re-recorded courses, community access, certification, validation, collaboration, consultation, okay, coaching. All of this is included in Ayurpreneur Silver membership. And this is level 1 membership and value of worth of 1,39,983. If you sum up the what you call the retail price, website price of all these courses is 1,39,983. But today, as I'm on mission to help 1 million Ayurveda professionals to achieve and live entrepreneurial lifestyle using their Ayurveda knowledge to accomplish, okay, the social significance, professional significance, financial abundance, and time freedom using our Ayurveda business model, because I know that most of us, we come from middle class. We come from the parents who have got the private jobs or a primary school teaching job, or who have got a very limited, what you call the income sources, but still they have helped us to become Ayurveda doctor. And I know the pain. So because of that, understanding the pain, and I am a mission to help. My mission is to help our Ayurveda professionals to gain their self-respect, self-esteem, professional and social significance, which we are lacking. For that reason, I am offering it at an unbelievable price, because I have put a lot of efforts in creating these courses. I'm still working on this. I have to show up and have got my own, what to call the costs every month, monthly recurring cost to maintain this platform. For that, I need to charge. I need to make at least minimum, what you call the support price for my efforts, for my investments, for my expenses. For that reason, I am giving it not at 1,39,983, not at 14,999, but at only 4,999 for lifetime access for all these things: community access, courses, consultation, collaboration, coaching, certification. Okay, so you can scan this code, this QR code, and you can join if you feel to be the partner, if you want to join your hands to build a new world of Ayurpreneurs, which the word I quoted. This is my bigger mission. I want to see all our Ayurveda doctors should live with pride, and they should leave behind a legacy where their children should feel proud of themselves. So if you are really to be, because see, I am not a leader, I have not achieved it. I have started my journey. I have started my journey as an Ayurpreneur. I have made a vision. I have got a vision. I am walking in that journey. And I request all of you to join with me that journey. We'll walk together. Let us make it happen in our lifetime to set up our own ecosystem of entrepreneurship. Okay. So this is possible only when we two join together. Okay. So it's my mission to build a vibrant community of Ayurveda professionals, exclusive community for collaboration, for mutual growth. So it is for 4,999. So you can, if you are interested to be part of this one, I request you, I welcome you for this one. You can scan this QR code and join it. I'll be happy to receive you there. And of course, we are still growing. It's a small now community, but we'll grow together once. And I am optimistic that we grow in millions. We grow millions. And once we grow millions, we can imagine no competition. We are all contributing for each other's growth. We are collaborating in a true sense to support each other. Okay. Because we'll be having our own blue oceans. Will not be having the same oceans. Will not be in red ocean. We'll be creating our own blue ocean. We'll be having our own different niche in Ayurveda as a specific experts, and we'll be helping each other. Okay, we'll be helping each other. So there is no competition, only contribution, only collaboration, only growth. So that is my dream, what you call the code of honor for this particular Ayurpreneur Lifestyle Hub. So this is there. So if you have scanned the code, you join it, and I'll be happy to receive you people. And if you feel good, kindly promote this community to all of our Ayurveda colleagues, friends, juniors, seniors, everybody. Okay. So if you're a student, still don't have the 4,999 to afford, I can help you to be part of our Ayurpreneur Academy. Ayurpreneur Academy is a bigger umbrella. Ayurpreneur Lifestyle is a more professional community will be there. So you can join Ayurpreneur Academy. Okay. because if you're a student, if you're not able to afford, you can join, so that whenever in future, when you test the waters, when you test our value additions when you test our contribution for your growth, if you feel pleased and if you want to upgrade to silver membership, you can get the what you call the discounts, you can get the what you call the consideration, okay, for the price, because over the period everything goes growing, isn't it? The price also starts growing. So if you become an Ayurpreneur Academy member now, you may enjoy the same price. Maybe in future, I don't know. But I may say now, but I don't know. I cannot guarantee it future. But still, you can have an extra advantage, and at least you'll have weekly calls, free access, which is totally offered for Ayurpreneur Silver membership. But that you can get at if you buy either Ayurpreneur Success Blueprint or Ayurpreneur Device Goal Setting Formula. Both are 4,999 at website price, but if you scan the QR code here, you can get it only for 499. 499. By this also you become Ayurpreneur Academy member. Okay. So thank you for being here. Okay. So if you want to scan it again, I will keep it there. So we can have, if you have got any questions, we can have questions. We can take up 1 or 2 questions because already it is too late, almost 2 hours it is going to be. So if you have got any questions, kindly put in chat box. 1 or 2 questions I'll take up. If no questions, we'll wind up the session. And if you need not to register for the next session, because already you are member of this Ayurpreneur Academy by registering this course, okay, this particular webinar. So the next webinar you'll be getting notification in your email. So you need not to register for the any note whenever I means send what to call the message of the weekly calls. Okay, in auto you will get the anyway you get the link directly in your Ayurpreneur Lifestyle Hub, what to call the mobile app. So download the Ayurpreneur Lifestyle mobile app. Okay, so you are already made a purchase, so you'll get access for the field section. You'll get access for the once you get the field access for the field section, you will have the notification links for all the forthcoming future webinars. So one thing is that for the people who are only with a free purchase, for webinar free purchase, if you come, the access will be for you people only for up to December 31st of this year. As a promotion, I am offering it. But after January 2025, okay, it is only exclusively for only Academy members or the Ayurpreneur Lifestyle Hub members. Total access will be there. So anyway, thank you for being with me. And there, as I could say, there are no questions in the chat box. And if you want to connect with me, there is a 9945079276 is my mobile number. You can WhatsApp me if you have got any queries. You can mail me directly vivekanand@gmail.com, or you can mail at ask@ayurpreneurlifestylehub.com. Okay. Ask, it is not support at ayurpreneurlifestyle.com. It is ask at ayurpreneurlifestylehub.com. Okay. So, so thank you for being with me, and I request you to visit our ayurpreneuracademy.com website also, where you'll have a free download ebook for you, which will help you to understand how to brand yourself as an Ayurveda expert in 6 easy steps. Okay. And follow me on Instagram and connect with me in LinkedIn. Okay. With my name, and subscribe for my YouTube channel, Ayurpreneur Academy YouTube channel. Okay. But that's all from my side. And thank you for being with me. And let me stop the screen share and let me stop the recording.